All right, let's talk about the healthcare system in the United States. So, the healthcare industry performs many different types of services. First is diagnosis. Or diagnosis. That means that they're going to say, okay, looking at everything that we have right here, we think that this is the issue right here. So that's just determining what the issue is first is a big part of it. You can try to do this yourself online. There's certain websites like WebMD and just Googling your symptoms. People do this all the time. Unfortunately, it's so much better if you have like a real expert doing this for you because then you know it's going to be more accurate because you might be saying that you have certain symptoms when really you're not showing them at all. So it's important that people don't rely too much on Google. It's great for minor things in case you're like, oh, okay, it's just this, not to worry. But if you're even a little bit worried, I would always check with a real licensed medical professional. Then there's treatment. So if you were diagnosed with having a certain type of disease or an illness, well, what is the treatment for that? How are you going to get better for it? So that's another thing that they do. They can tell you where to go for the treatment, where to go and get the medicine that would help you treat it. That's all part of it. Then there's rehabilitation, sometimes known as rehab. So let's say that you broke your leg severely, where it's to the point where you need to rebuild up the muscles in your leg again to walk again. So if you go to these rehab facilities, they can walk you through, provide some kind of physical therapy where you can do exercises or certain types of walking activities to help build up that muscle so that you're able to walk or maybe run again easily, fine again in the future, but not if you don't go through that rehab first. Then there's prevention. So while we want to be able to treat people, one of the best ways to treat people is to prevent the disease or the affliction from starting or spreading in the first place. So if we can put some money into preventing it, the more that we put into preventing it, that pays off so much more in our healthcare later on. Part of that prevention is education. So, I mean, you are, experiencing education right now, health education, and that's a big part of it. If we can prevent you from having medical problems later on, that's going to save you money and it's going to save everybody money in the long term and potentially save your life. And then there's research. So we act in the interest of when we do things, we're doing it based off of research, hopefully, right? If you read in a medical journal that, oh, this is supposed to decrease your chance of getting cancer, you're probably going to say, oh, I don't want to get cancer, I'll do those things. But they have to be backed by research. It's not just some guy telling you that they heard it one time. It should be they heard it because they read it in a journal and it was performed with like scientific research that was funded at maybe like a university. So that's what we're talking about with that. There are physicians and specialists. So a regular doctor, which for you would be a pediatrician, or if you're an adult, it would be your primary care physician. They provide what's called primary care. It's like the first level of care. They're more of a generalist. They know a lot. They know a good amount about a lot of topics, but they're probably going to get to a point where they say, okay, you might have this issue, and that is an issue I know this much about, where I should know. You want somebody that knows like way more than that, right? So a medical specialist possesses extra training and experience with certain types of diseases and disorders. So I know, like for me, when I was in like fifth grade or so, I went to the doctor and I was complaining that my feet were starting to hurt. And this happened a lot after football practice. And he was like, you know what? It could be something that like really simple. It could be more complex. I don't know. I'm going to send you to this podiatrist I know. And the podiatrist specializes as a foot doctor. So I went there. He took one look at me walking and was like, you have flat feet and you need to wear inserts in your shoes and that will help you with it. So my primary care physician may have known how to do that, but he didn't know the exact treatment for it. That wasn't his area of specialty, but the medical specialist does know that, and that's what they're for. Healthcare settings. There are two different types of facilities you can have. An inpatient facility are hospitals where patients live there, like temporarily. They reside there while they receive comprehensive and overall care there. Outpatient facilities would treat patients who do not require a hospital stay. So you go there, get checked up on, and then you would leave again. So I'm sure a lot of you have experience in outpatient facilities already. Hopefully less of you have had serious, care where you need to stay overnight in a hospital, because that's always scary. So let's talk a little bit about healthcare and health insurance. So healthcare is incredibly expensive. I think it's roughly about 1/3 of our entire government budget goes towards healthcare, which is wild to think about. So because it's so expensive, we buy insurance to help pay the healthcare costs. In general, I'm just going to summarize this. Healthcare is really complicated, but let's just go like about this. In general, if you have a class of 20 people, right? Hopefully nobody's going to get sick. But let's say that one person, let's say it's me, develops like a really serious illness, and that illness may cause hundreds of thousands of dollars to basically cover. So if that same illness happened to all of us at the same time, the healthcare system is overrun. They can't afford all of that at the same time, right? And if we didn't have healthcare and you had to pay for it, those hundreds of thousands of dollars, who's going to have all that money sitting around? So that's not possible either. So instead, what you do is you pay a manageable amount per month, and then you're covered in case something bad happens. Even if that amount is more than what you can afford, that's where the insurance comes in from. The way they make money is they're expecting that not everybody's going to need it, and everyone's going to pay a little bit more than would actually be necessary. So it's almost like you paying it just in case something goes wrong, and you hope that nothing does. So that's the general idea of health insurance, is that you're paying for the care always a little bit at a time, and then when you finally need it, there it is. You could think of it, it's really similar to like phone insurance. If you have something like that, you might be paying $10 or $20 or something extra a month just in case your phone gets ruined, and then you don't have to pay the same amount as a brand new phone if you were to do that. So it kind of works similar to that in the healthcare system. So now I need you to think, this is a tough issue right here. What should happen if someone gets hurt and they need to go to the hospital, but they don't have insurance? Unfortunately, there are a lot of people that are uninsured in this country. So there's no easy answer to this one. What happens to it? Do we say, well, they go and then they'll worry about it later? That is a possibility. Some people will never be able to pay the medical bill. So what do we do with that? Do we put them in jail if they can't do it? Do we forgive the debt and just, like, as a society, we'll just pay for it with all of our money like that? That's kind of one of the big debates that's going on in this country right now, is what do we do about this? There are some people who buy extra health care because they want really pristine health care, and then other people that just want the bare minimum. They'll take the risk. So you're going to have to decide about yourselves. If you may not, right now you don't have any choice in what your health care is, but your parents have to think about this type of stuff. So it's something that you're going to have to think about going on in the future too. There's always talks about, should we give everyone free healthcare in this country and then just all pay for it with our taxes? Some people think that's a great idea. Some people think that that's going to be a horrible idea, because you wouldn't get the same quality of treatment that you would if people were able to get their healthcare like through their jobs. So it's a big point of debate, and there's lots of good, I think, arguments on both sides of it, and we'll see where that goes in the future. So the last thing that I want to make sure that you definitely write down is, who are the health and the fitness resources in CDW for you to access? So if you have a question about how to be healthy, whether it's, how to eat right, or just how to exercise correctly, anything like that, who can you turn to? So those people are your health teacher. That'd be me. You can always, of course, go to the nurse. She is trained in all sorts of things, and I'm sure that you've had, that's one of the first people you go to if you are feeling sick. She's an expert in that, so she can help you there. And then there is your gym teacher. So that's another great place to go to. Your gym teacher will be able to also trained to be a health teacher just like me, and obviously knows lots about staying physically fit. All right, so that's it.